Hospital in the Home, Shane and Davina's story. Welcome to Shane's story about his experience with the Hospital in the Home program. Hospital in the Home delivers specialist level treatment to patients outside the hospital environment. Treatments like home intravenous antibiotic therapy. Patients who are medically stable occupy a virtual hospital bed at their own home. They are supported by a team that may include doctors, district nurses, pharmacy, occupational and physiotherapy services, dietitian and social workers. Shane had a complex infection that started in his kidney and extended to other tissues around it. After several weeks in hospital, Shane was stable enough to go home, but still needed 3 more months of intravenous antibiotics. The ward team referred Shane to the Hospital in the Home coordinator, who assessed him as being suitable for the Hospital in the Home program. The coordinator worked with the inpatient team and with Shane and his family to prepare him for discharge home. Meet Shane and another important member of his team, his wife Davina.
I suppose if we never had them, I'd be still in hospital.
Yeah, so we're very, very grateful.
And I was just getting sick of hospital, after all those long weeks. I just
missing home.
Missing
home
the kids.
The hospital prepared us by giving us all these things so that he could be comfortable and, like the chairs, for showering, everything, so that he could be safe. I think culturally it's been good for us because we can have all the family involved, We're all sitting at the table, some of us are having breakfast over there and then I'm doing the infuser. I said to my little one, he's 8 years old, our baby, I said, have you seen Mum do that? Yes, I have. Can you explain to Mum how that goes? He said, yes, Mum, you do this, you get the syringe and you push that through. So yeah, they're all very much aware and a part of it all. So yeah, I think it's been great.
Shane needed a PICC line for the nurses to deliver his antibiotics through. PICC is the short name for peripherally inserted central catheter. This long, thin catheter is threaded up through a small vein in the arm, and the tip rests in a large vein above the heart. The catheter is painless and can remain safely in place for many weeks. The infuser is a simple device with a medication-filled balloon inside a hard plastic bottle. It is light and portable and worn in a belted pouch around the waist. The infusers are prepared in a factory in Auckland and transported by plane and taxi to the local hospital pharmacy, where the pharmacist checks and dispenses them. The district nurse picks up the chilled infusers and visits the patient daily to change the infuser, review the PICC line, and do a general assessment of the patient's status. District nurses are available 7 days per week, all day and into the evening. Management and concerns are discussed on each visit. At night, the emergency department is set up to manage any concerns. Shane and Davina are key members of the team and have learnt to monitor for, troubleshoot and report any issues. Shane was required to have blood tests done once or twice a week to measure his response to the antibiotic. He also was reviewed regularly in the outpatient department by his medical consultant. If Shane developed fever or other problems, he was reviewed immediately. When Shane had been on the program for several weeks, he and Davina were ready for more independence, and Davina learned how to change the infuser daily. District nurses continued to visit twice weekly for support and blood tests, and outpatient visits continued.